Hi, this is Asaziia Krichena, an NSS volunteer of Asufii Christian Institute, Manipur. We are all certain about the crisis that is largely looming over all mankind, the COVID-19 pandemic, which has still now infected millions of people and hundreds and thousands have died from it. Therefore, there is a widespread fear and confusion instilled amongst various communities across the world. With this fear and uncertainty about who might be infected and who is not, created a huge loop of stigmatization across the world. This social stigma has been endlessly adding fuel to the fire which has already been burning red hot. To contextualize, let us see the situation of India. The government of India has imposed strict lockdown since March and have been extended till May 3, and it is true that every single person is affected by this decision. But the weak and the poor ones are the worst affected, which accounts for about 176 million people out of the total Indian population. Bearing the unavailability of the daily food and water, they are hugely being stigmatized by the society of higher classes. There are a huge number of these people who work outside from home, and as transportation has been halted, they are helplessly stuck at the various places they have been working, deprived of their physical and mental needs, leaving them insecure of their livelihood. Coronavirus has increased racial attacks. People from Northeast are being called Corona just because of their racial makeup and resemblance towards the Chinese. We have seen and read in news about various ugly incidents which have been doing rounds in social medias and printed medias about how certain people have been targeted, spat on and barred from doing grocery shoppings. These racial attacks have definitely led the targets to suffer from social stigma. Incidents like this needs to be strictly monitored, and we must share social responsibility as we combat this COVID-19 pandemic. Similarly, the inequalities which got resulted due to the lockdown in India puts the life and existence of the migrant workers in a precarious condition. We have seen incidents where migrant workers are being harassed and are exposed to chaotic situation of hunger and poor health. To make the matter worse, there are some instances where patients who recovered from COVID-19 and are back home are not free from the trauma they just went through because of social stigma. Last but not the least, it is very unfortunate India has been witnessing steep rise in domestic violence against women amidst this lockdown. More than 200 cases have been reported to the National Commission for Women. Such incidents are the last thing we want to see happen in and around our country when the biggest enemy is coronavirus. Therefore, I urge all the citizens to refrain from being irresponsible and start treating each other humanly during this time of COVID-19 outbreak. We need to show more love to the poor, the old, the weak and the underprivileged. The travelers stranded in a strange land far away from home, either from another country or another state of India. It is the need of the hour and is utterly important that we give humanity a chance and show what being human really means. All India Institute of Medical Science Director Dr. Randip Guleria said that social stigma is far more dangerous than the disease COVID-19. While 90 to 95% recover, the mortality rate of the disease is rising due to the stigma attached to this disease. So, we must be careful with our words, stay away from social stigma and lead a positive life. Thank you.